352-369-9101.
Ocala's information station, 1370 WOCA.
Ocala.
I'm in a good room right now. I got 4 beautiful women in the room with me, so I might pass out. This is like skydiving. You might pass out. That's what they say. You might pass out. How come I don't hear anybody? Okay, let me tell you who's here. Dr. Kristy Paquette is here. We haven't seen Dr. Paquette in a long time.
Hi, Larry. Hi, Robin.
How you doing?
Good, good.
We bumped into you over in Silver Springs one time.
Yes, beautiful park.
We were playing music and you were on the swings.
Guys, my favorite thing to do on my day off.
We have notes too. And Leah Caruso is here. How you doing, Leah?
Hi.
Looking and smelling really good.
Thank you.
And Suzanne Santangelo is here. Also, I got a hug from everybody, Robin. I got a hug from all the women.
I know. You are just hot to trot, let me tell you.
Well, you know what? It's the shaved look, you know?
That's right. That's right.
That's I had a beard.
I like clean.
There
you go.
A beard was different for me. Okay. So good morning. How are you all doing? Everybody's fine?
We're good.
We're going to talk about women's health, right?
Yes. Yes.
Women's health. Okay.
Yes. And sweating to the oldies.
Does women's health different than men's health in anything other than reproductive ways? In other words, our lungs are the same, our hearts are the same. All that's the same, right? Or am I wrong about that?
Well, to a certain extent, yes. But, women have smaller lung capacity than men, typically, on a statistical scale.
There you go.
Trying to show off my ability here.
Muscle strength. Typically, testosterone builds stronger muscles, so that's why men are statistically stronger than women. Mm-hmm.
Physically,
yes. Yeah, exactly. Hormone, especially when we start talking about menopause and...
So are we really, at the mercy of our chemicals? I mean, everything I am is because of chemicals that my body produces?
Well, who was it that said humans are just a bag of chemicals? I mean, that's kind of like what we are.
Why a bag? Why couldn't they say a cylinder? Why'd it have to be a bag? Something's firmer than a bag.
Yeah, a tube of chemicals.
So, but when you're working with women, though, when we say women's issues, it usually is, we are talking reproductive or no?
Well, we're talking pelvic floor and, bladder.
Do I have a pelvic floor?
You do have a pelvic floor.
I have one?
Yes. Yes. See,
where is it?
Men and women have the same muscle structure, but women have, an additional opening to allow the passage of babies and such. Mm-hmm. And so that tends to, play into issues with gravity and bladder prolapse and but your muscle structure, your muscles, the same names and the same general orientation than a woman. So you could do Kegels and strengthen your pelvic floor and benefit
nobody
from that.
Would know you're doing
Does anybody
and
know?
Nobody knows what you're doing.
Do you know that I don't know what a Kegel is? I've heard it. I've read it. Can you tell me what it is? I'll tell you what somebody told me it was.
What'd they tell you?
But this was another guy, so I don't know if he's telling me.
So Caitlin?
Who?
Caitlin and Bruce.
No. I've never spoken to them.
I get it.
All right. This is what they said. They said it is start to pee and then stop. Is that it?
Technically, yes. So what?
It's different.
Oh my gosh, there's so many caveats around that. Where do I begin?
And you can do that right now, just sitting there? I would have a hard time doing that.
I do it in my car. Oh.
You do it in your car?
You
can do it anywhere.
On the road, you're like, oversharing.
Well, you have to do that to keep it strong.
Right, exactly.
What?
All right. So let's get back on.
What does that do, though? What does the Kegel thing do?
Well, so Dr. Kegel was a gynecologist.
Did you do this, Leah?
Back in the day.
Good for you.
And so he started encouraging his patients to exercise their pelvic floor. So what you described, is when you start to pee and then you squeeze those muscles, you're squeezing your pelvic floor, and what that does is cut off the flow.
Okay.
Because your bladder, you can't control your bladder. It's an automatic muscle. Your bladder's a muscle.
So does it help somebody who's incontinent, trying to keep this as a useful conversation? Does it help?
It does. It does. It can help many.
Okay,
women.
so
it doesn't help everybody, but it does overall help a lot of people.
Okay, if you do push-ups, you eventually become fatigued. Can you become fatigued doing this exercise?
Absolutely.
Really?
Yeah.
To the point where you say, "Oh gosh, I'm tired. I'm not doing it anymore."
Yeah, absolutely. Well, a strong muscle, a strong muscle is a healthy muscle. So if you overwork it, it becomes weak, and you're counterproductive. So if you do too many Kegels and you're fatiguing the muscle, then you might increase your incontinence issues. So you want to, be smart about how you exercise.
Men don't need to do this.
Men don't
you do?
have the same issues that women do as far as, incontinence and...
Hey, Frank.
See, you did know somebody walking.
Yes, I did know Frank, yes.
Yeah, so it's yes, men need to do it too, but women have more of an issue with gravity.
Because there's an opening.
Because of the prolapses and the fatigue and things like that.
Okay.
Well,
sorry.
Oh, I got a confused look.
Well, when
That's exactly what that meant, yes.
Well, when women come to you with their pelvic floor issues and you give them physical therapy, how do you make whatever it is right again?
Well, physical therapists specialize in muscle and bone and joint and physical things. So what I do I approach a woman's health patient the same as I approach anyone. It's, let's look at how strong you are. What are the pain issues that we might be dealing with? How are the bones in your pelvis working in relation to each other? Because all of those muscles are attached, and all of those muscles are, connected, and they interact. So I look at the whole package and try to figure out, is your pelvis rotated? The pelvis is two separate halves that have to rotate when you walk. So some people, they get stuck, and then that puts extra pressure on certain points and can, pull things out of whack. So we look at the whole thing and do muscle testing. And
so does pregnancy have an issue too with that?
Oh my goodness, yes. That's like number one on the hit parade. Yeah, well, because when you're pregnant, you have different hormones that are, produced in different quantities in your body, and that they relax your ligaments and, to make way for the baby to come down the pelvic canal, the birth canal. So you're getting more laxity in your pelvis. That can cause a lot of pain in, the SI joint, the sacroiliac joint right there on the base of your spine. A lot of women have back pain when they're pregnant. It can cause a lot of problems in the front of your pelvis where that pubic symphysis is, because it's not being held as tightly. And so it can wobble. It can wobble. It can put a lot of pressure.
Might hurt the baby then, too, if you don't fix it.
No, it more hurts the mom. It's just uncomfortable and painful, and you need to be careful about some of the activities that you do, because you could really strain yourself. But so pregnancy, working with women post-pregnancy after birth, the muscles are all stretched out. Sometimes you have to have a surgery, to open the widenings.
I've been lucky then, because I've had two children, and I flew through both of those pregnancies.
Awesome.
Knock on wood.
I have just one son, and it was so easy. So nothing.
Didn't bother you at all.
No,
not a problem.
So getting back to the chemicals and the difference in women and men. When you go to the vitamin counter and you see there's one a day for women and one a day for men, is that really formulated to help? Like, you really have a different need in your body? Like, you couldn't, like in the old days, one a day was for everybody. Now they've, right?
Right.
And age too. For
and age. Well,
Oh, really?
You metabolize things a lot differently as you age. Women, we have a monthly cycle, and so we lose a lot of iron. So a lot of doctors recommend that their patients take extra iron.
Wow.
Up to the first break. Let's take the break. If you have a question, you are invited to call. The number is 622-9622. Suzanne Santangelo is here from Ocala Health. Leah Caruso is here from Strive Rehabilitation. And Kristy Paquette is here also from Strive, correct? We'll be right back. If you want to call in, the number is 622-9622.
The weather is brought to you by myfwc.com. Safe boating is no accident. Partly sunny this Thursday with a thunderstorm around this afternoon and evening. The high today 88 to 92, then partly cloudy later Thursday night with a low of 73 to 77. On Friday, times of clouds and sun with a shower and thunderstorm or two in the area, becoming breezy, high 88 to 92. For Saturday, mostly cloudy and not as warm with a couple of showers and thunderstorms around, high 84 to 88. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Veterans are the foundation upon which our freedom is built. Listen to The Source, WOCA, each Thursday at 9 a.m. to Veterans News with Hank Whittier from Vets Helping Vets. You'll hear tributes, information on veterans issues, and stories that will make you laugh, cry, and feel proud. Veterans News always focuses on the military, past and present, and on our first responders. Veterans News is brought to you each week by Bob Wine's Camellia Gardens and Nursery, keeping you blooming since 1952.
Need a mailbox rental but need more information? Remember, Personal Service Center, 789-6683. How does $10 a month sound with just a 3-month commitment? Remember, Personal Service Center, 789-6683. Mention WOCA and the setup fee is waived. Personal Service Center will email or text notifications to you when your packages arrive. Even scan mail so you never actually have to pick it up. Now that's service. Personal Service Center, 789-6683. Located on the corner of Northeast 25th Avenue and 24th Street, Ocala. Look for the yellow signs.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
That was the sound of a tree falling. It could be your tree. You're going to have it trimmed, but never got around to calling Pride Tree Service. It could have fallen in a field, and now all you have to do is call Pride Tree Service, and they'll have it quickly out of the way for a great price. But don't wait until the tree falls. It may not fall in the field. It may hit your car, your house, or worse. So call Pride Tree Service today and avoid all those headaches before they happen. Pride Tree Service, 572-2510. That's 572-2510.
It's 17 minutes after 11 o'clock. Thank you for tuning in. Remember, if you want to call in, you're invited to do that. The number is 622-9622. Dr. Kristy Paquette is in the studio. We're talking about women's health in particular. Suzanne Santangelo and Leah Caruso are, of course, here. They are who invited Dr. Paquette into the studio with us this morning. So thank you, ladies, for all being here again.
Thank you, Larry.
So do you mostly deal with younger women or older women, or is it the whole spectrum?
It's the whole spectrum. I've had, girls in high school who have, strained things from sports activities, and I've had women in their 30s with pelvic pain issues, in their 50s and 60s, and then all the way through to 80s. And
so, what do you do about pain? That's what do you do about that?
Yeah, well, it depends on where the source is. So first thing we have
right here. This is the source right here.
But you're not a pain. You're the...
I know. You say I am or I'm not?
So yeah, we want to take a look at the source of, what's causing it. Is it a muscle issue? Is it a trapped nerve? Most often I find that it's tension. It's muscle spasms. And often, these women have been to every specialist on the planet, and, they're not getting any help. The gynecologist and the urologist, they do all their testing, and they might be sent to a pain management specialist where they're getting cortisone injections or, shots, and, they still have the same symptoms. So oftentimes they're just so thankful and relieved that somebody can speak their language and know,
And is the treatment...
I'm not crazy.
Is the treatment a medicine? Is it a procedure? Is it exercises or something?
It's physical therapy. It's, relaxing the muscles through massage or soft tissue mobilization. It's, going back to the pelvis and how is it aligned? Is there something out of whack? How do we work? If you have a tight hamstring on one side, that's just pulling everything out of alignment. So.
Really? So you could be massaging something a foot away, and it would affect the area that's painful.
Oh, everything's connected. Your toe bone's connected to your nose bone.
Do those sports doctors know that? Because the women, women's baseball teams, basketball teams, the gymnasts, are all those sports doctors aware of that, or do they have someone like you on their staff?
Well, it depends. There's a broad spectrum of, awareness and education and training. And so, hopefully people who are, dealing with the youth are kind of aware of, where the cutoff is and how to treat their patients.
Is the pain ever from the husband?
That's higher up. That's in the neck. More towards that.
Do people need a referral to see you, or can they just come to see you on their own?
Well, we could do an assessment, but if we're going to do continued treatments, then a doctor would refer a patient.
So
to
do you ever have a lady
therapist.
who's had an issue for a long time? Comes to see you, you have a simple, quick solution, and they say, "Oh my gosh, I've been living with this for years." Has that circumstance ever happened?
It's happened, not as often as I would love it to happen, but it has happened. Pregnant patients who come in with, pain from instability, and we can show them some exercises and show them how to
while she's pregnant.
Right.
Okay.
Yeah.
Okay.
Do some alignment, get a special support belt that helps out, and they're like, "Oh my gosh, I can sit down, I can lie down, I can sleep."
Really?
It's amazing. Yeah.
And
it's very rewarding.
After the baby's born, are there some issues that remain that you can help them with?
Well, not typically, but on occasion, women will have incontinence issues because, if you had a significantally large baby that was pressing on.
That was me.
Those
I was a significantly large.
You were a big baby.
Yeah. Right here.
How about women that have to have a colostomy, and they have to have that the rest of their life?
That's an interesting question.
Yeah, really.
Yeah. Well, okay, so dealing with the colostomy, then you're looking at, you're going into the abdomen and you're weakening those abdominal muscles. So that's something that, we would look at. How is that impacting your balance? How is that impacting your stature, your posture? Looking at those endurance type issues. Yeah.
Okay.
Yeah. But, colostomy, another thing that's related to incontinence and pelvic floor is if you have chronic constipation.
Oh.
So what happens when you're chronically constipated? You're in a squatting position and you're pushing hard and you're straining those pelvic floor muscles that are helping to support your bladder and your, all the organs that are in your abdomen. So
you can help with that then.
Absolutely.
You get them back regular.
Well, I don't treat the constipation per se, but we can look at, the muscle strain in the pelvic floor and, maybe give some guidance about, talking to a specialist on nutrition.
Oh, that's wonderful.
Yeah. Yeah. Several of the medications that people are on can cause constipation, so that, having a chat with your doctor about what are the side effects and how do we address this.
Oh, my.
Because this is relating, now I'm, incontinent or I'm leaking or I can't, go
that's
out
an issue, the leakage.
to lunch with my friends without having to, go to the bathroom several times. And yeah, it's a lifestyle issue. I mean, it really can impact people's lives.
If you put the headsets on, you'll be able to hear a phone call coming in. Let's take that call. And hang in there just a little bit. Can everybody hear me, first of all, in your headset? Kristy,
Yes.
can you hear me?
Yep.
Yes. Good morning. You're on the air. Thank you for calling in, for waiting. You're on the air.
Yes, thank you. This is a guy calling. A quick question. All my friends in my past that I'm going to be like traveling back home over the summer, and I'm going to run across a lot of buddies and everything else. And just about every guy I know has had hernia surgery, but never his wife or any female that I've ever heard of. Is that a true statement? And why did just men get hernias?
Well, women do get hernias, but again, it goes down to anatomy. The male anatomy, where the testes come down through the abdomen, there's an opening to allow the vas deferens. Don't quote me on this. I'm not a a urologist, but so the male anatomy, you have a weak spot where where the testes go down.
That is a weak spot.
And then the colon can slip down through that, and that's what can cause the hernia.
That's what a hernia is?
A hernia is where the intestines or any tissue goes where it's not supposed to go. So you can have a hernia high up where your esophagus goes through your diaphragm, and you can get things popping up through your diaphragm. And you can get a hernia down lower where your intestines are. So, yeah. So women do get hernias, but typically it's not quite as painful because,
But it was, okay, but we don't hear about it as much. Or maybe it's not called a hernia. Do you call it something else?
No, it'd be called a hernia.
Oh, okay.
Yeah.
All right, thank you.
Good question. Thank you.
Very good question. The phone line's open if you want to call and ask another question. The number is 622-9622. If it's really personal and you don't want to ask it on the radio, they can call you guys, right? What would you suggest?
Well, they can call. We have a consultant nurse number. It's 800-530-1188, and there are nurses on those lines 24 hours a day, and they can help you, direct you on where to get some treatment, and or even answer your simple questions.
How about women that they have a stressful job, like they're a police officer and they're out walking the beat and stuff like that every day? Does that add to their discomfort for their pelvic floor, or do they compensate by doing some kind of exercise?
It could allow walking. If you're running or engaging in high impact activities, you're putting, strain on those muscles. So, a lot of times when we go to strengthen ourselves or work out or exercise, we do the big sit-ups, we do the big exercises. We don't look at the smaller muscles that help maintain balance, and doing the push-ups and the sit-ups are good for the big moving muscles, but we also need to do the Kegels and the planks, those...
What are the planks?
Hey, what is that?
those core muscles, working on those smaller core muscles.
Do you do that? You do planks?
I do.
How do you do that?
Not as often as I should.
Is that something you do on the floor?
Planking, isn't it?
Exactly. Yeah, it's something you do on the floor. You're on your hands and knees, and then you're leaning on your elbows, and then you kick your legs out behind you, and you're just like a board.
Oh, okay.
No way. You can do that? You're just holding yourself up on your elbows?
Yeah, you just you're holding your belly up off the floor.
Oh, okay.
And your legs, everything's up off the floor except for your elbows.
No. Toes, my toes and my elbows.
Oh, your toes are holding you up.
You're like in a push-up position, but on your elbows.
There you go.
And you just hold it there?
Yes.
Yeah.
For how long?
As long as you can.
Just as long as you can to start, but then you gradually increase it.
And where do you feel it? And you
Everywhere.
You do it too?
It's a core.
I try
Suzanne, do you do it?
I'm not quite there.
No, I should.
No?
But I don't.
You do planking?
I have heard of it.
Yeah, absolutely. Core muscles. Building those core muscles and keeping your posture are, something that we
need to do more often.
Wow,
that sounds like a man would benefit from that too, not just...
Oh, yeah, absolutely.
Yeah, definitely.
How does a woman know she needs pelvic floor therapy? What kind of symptoms does she feel?
Well, if you feel warm liquid running down your leg when you cough or laugh or sneeze or...
Just checking.
If you're going to the bathroom every 45 minutes to an hour, 6 times a day is average. If you're going more often than that, then you really need to think about, what's causing that. Getting up in the night more often than once. Once is allowable. Once is acceptable. But if you're getting up 4 or 5 times in the night to pee, then,
Oh, so they should come to see you then. They're having issues.
Yeah, you might have an issue, and you.
Do you know who we spoke to? Do you remember the show, The Beverly Hillbillies?
Oh yeah.
We spoke to the guy who played Jethro.
Did you really?
Yeah, and we were asking him about
Max
the
Baer.
other cast members.
Yeah.
And Miss Jane has died.
Yeah.
And the actress who played her died from dehydration.
Wow.
And she wasn't drinking enough because she was incontinent. She
had to get up and pee.
Yeah, so she was, and so I thought, wow, if you're incontinent, just keep drinking water. You have to drink water. So it was an eye opener.
Right.
And
it puts people at risk too, because if you're older and you don't get around as well, if you're rushing to the bathroom, you're going to rush. You might make a mistake and trip and fall.
I know.
You could break something. Yeah. So, I mean, it's a very critical, serious issue.
And do women in wheelchairs, do they have this issue? If they're wheelchair bound, they're...
Some do. Yeah.
Before we say goodbye, we want to give out some phone numbers, and you have some programs.
I'll just repeat the consultant nurse line again. That's 800-530-1188. And if you call that line, as I said, there's nurses there that can answer your questions. It's also a physician referral line, so if you need help in finding a particular doctor, and certainly they can answer any questions about our women's services at Ocala Health too.
All right. Suzanne, thank you for coming in as always.
Thanks for having us.
Leah, good to see you again. And Dr. Kristy Paquette, good to see you again.
You too.
Will we see you again? Maybe out in Silver Springs?
Yeah.
Swinging down the swings?
I'll save my swing.
What did we play? What were we playing? Were we playing...
You were practicing for an upcoming...
Something.
Performance.
Thank you, ladies. One day we'll come here, we won't talk about
whatever
health.
you play. Whatever you play is
We'll just talk about something fun.
It was wonderful.
But anything but skydiving. No skydiving. no bucket list skydiving. All right. Thank you all. Thank you for coming in. We will take a little break. We'll be right back.
We're saving thousands with Robert Palmer. So rule number 1 is always shop around. Always shop around. If you're trying to get a mortgage, if you're trying to get the best credit card, if you're looking at student loans, cell phone bills, you name it, rule number 1 is always shop around. Always shop around.
That's rule number 1, just one more vital part.